Good morning. I see you're here because you're experiencing pain in your arm. Can you tell me when it started and if you've had any history of blood clots, trauma, or repetitive strain injuries?
我大约2个星期前开始觉得痛，特别是搬了些重的盒子之后。还有，我右边的肩膀和前臂有肿胀。
It sounds like it could be Paget-Schroetter syndrome, also known as effort thrombosis. This is a rare condition where repetitive movement leads to compression of the subclavian vein, causing blood flow obstruction. Have you also been experiencing numbness, tingling, or weakness in your fingers or hand?
有，我有时会觉得针刺的感觉，特别是用手臂很久之后，还有手经常觉得冷。
These symptoms are consistent with thoracic outlet syndrome, which can cause venous compression. In Paget-Schroetter syndrome, the subclavian vein becomes compressed between the clavicle and the first rib, leading to venous thrombosis. This can impede blood flow, causing the swelling and discomfort you're experiencing.
我们可以采取些什么步骤来治疗它？药物够不够？还是需要做手术？
Treatment typically begins with anticoagulation therapy to prevent further clot formation. We may prescribe medications such as heparin or warfarin, and in some cases, we may recommend thrombolysis, a procedure where a clot-dissolving drug is directly injected into the clot. Surgery may be required if the vein remains blocked or if there is significant vascular damage.
手术有什么风险？有没有一些潜在的并发症应该留意？
The risks include infection, bleeding, nerve injury, and blood vessel damage. There's also a small risk of recurrence of the condition, especially if the underlying compression isn't fully relieved. However, the risk of complications is low, and the majority of patients experience significant improvement after surgery.
如果不需要手术，在服药期间怎样管理症状？
If surgery is not necessary, managing the condition conservatively with anticoagulant therapy and physical therapy is often effective. You may also be prescribed pain management medications such as nonsteroidal anti-inflammatory drugs. Additionally, we'll work on improving posture and reducing the strain on the shoulder muscles through stretching exercises and strengthening routines.
我需不需要调整日常活动，例如工作或者运动？
Yes, for the time being, I recommend avoiding activities that require heavy lifting or repetitive motions, particularly those that put strain on the shoulder. You should also try to avoid positions that compress the thoracic outlet, such as raising your arms above your head for long periods. Low-impact exercises like swimming or walking are generally safe, but we'll tailor your activity level to your specific recovery needs.
有什么我可以做来预防以后再次发生呢？
Preventing recurrence involves avoiding repetitive trauma to the shoulder and maintaining good posture. Strengthening exercises for the upper body, especially the shoulder muscles, can help prevent compression of the thoracic outlet. Maintaining a healthy weight and staying active will also improve circulation and reduce your risk of blood clots.
有没有可能会发生在我另一只手？
It's possible but less common unless you engage in similar repetitive movements with the other arm. If you have a predisposition to clotting or anatomical abnormalities on both sides, the risk might be higher.
谢谢医生，我很感激你提供的信息。
You're welcome. We'll now perform diagnostic imaging to confirm the diagnosis. A Doppler ultrasound is often the first step because it helps visualize blood flow in the vein and detect any clots. If necessary, we may follow up with a CT venogram or Mr. venogram for more detailed imaging of the veins and surrounding structures. These tests will also help us determine the extent of the compression and clot formation.
我需不需要验血？
Yes, we'll order blood tests to check for clotting disorders, such as factor V Leiden or antiphospholipid syndrome. These tests will help us understand if you have an underlying predisposition to forming blood clots.
我可以继续上班吗？还是应该休息一阵子？
It depends on how severe your symptoms are. If you're able to manage your symptoms and the swelling isn't too bad, you can continue with light duties that don't strain the arm. However, if you're lifting heavy objects or performing tasks that could aggravate the condition, I would advise taking time off to rest and allow the treatment to work.
谢谢医生。
You're welcome. We'll work together on a treatment plan to help you recover fully. If you have any questions or notice changes in your condition, don't hesitate to reach out.